Good morning, everyone. It's a couple minutes after 8, so let's go ahead and get started. Looks like we have a couple people who have joined the webinar, but not audio. So, Kristen, if you can hear me and put the number in the chat box, that would be
I will do that.
Awesome. Thank you. Okay, so good morning, everyone, and thank you for joining the Quarterly Quality Exchange for Get With the Guidelines Coronary Artery Disease. We have quite a bit to go over, actually, so I think I'll just move through the slides, and then we'll have time at the end for Q&A. But this is Lonnie Den. I'm Regional Vice President of QSI and Mission Lifeline for the American Heart Association Southwest. And we also have Kristen Waller, and she's the Director of Quality and Systems Improvement for AHA Southwest in Arkansas. And she's at a conference today, so she's running the webinar for us, and she'll chime in. I'll move through the slides, and Kristen will just join in when she has any points to make. And so just really quickly, what we're going to talk about is U.S. News and World. We're going to go through the recognition criteria because a lot of that is in transition this year. And then we'll talk about what we're going to be looking at next year with 2020 data so that you can start to prepare your teams and be thinking about what you will want to work on to be at recognition level. Feedback reports, and then we'll talk about voluntary public reporting, which is coming soon, and a few important dates and events. So we want to just congratulate everyone that hit recognition status. We're really excited for you, and want you to be aware that if your hospital was at silver or gold award level, that you were featured in U.S. News and World Report. You can get to that report by following this link, and we'll send the slides out probably tomorrow or the following day. We'll get the slides out to you and any supporting documents that will be helpful to you. But you can get to the U.S. News and World Report online. And we can also send you an electronic version of that report. So congratulations to everyone that hit recognition status, and want you to know that it's out there. And you can forward the link to whomever, your managers or your teams. Just a reminder, we have 3 levels of recognition. Bronze level is for 1/4 of compliance, and silver is for an entire year of compliance with the achievement measures, and then gold is 2 years of compliance. And then for hospitals that meet that plus measure, which is a transfer measure this year, there's a little plus award that goes along with the baseline achievement award. And this, you don't have to meet, the plus level to get a baseline level award. It's just kind of like an add-on or a gold star to your award. So let's start talking about the achievement measures. For recognition, we will run your data in the spring of next year. The date that you'll need to have all of this year's data in by is the last day of February next year. So you have until then to edit any of your data, make any corrections, and then after that date, we'll be running your 2019 data for recognition. And the measures this year, the achievement measures this year that go into recognition are in green here. They're arrival to PCI, so there's 6 of these. Arrival, essentially door to balloon within 90 minutes. And then the top 1, EMS, first medical contact to balloon. So when EMS is eye to eye with that patient, the clock starts. And then PCI, or balloon up at your facility is the stop time, and we want that to happen within 90 minutes as well, unless there is an extended drive time. So you get 120 minutes when the EMS drive time is equal to or greater than 45 minutes, but the door to balloon time at your place has to be equal to or less than 30 minutes. So those two need to happen for you to meet that measure when there's an extended drive time, and you get the 120 minutes. And then aspirin on discharge, beta blocker on discharge, statin or lipid-lowering drug on discharge if the LDL is greater than 100, and then ACE and ARB at discharge if the patient needs it, if their EF is less than 40%. And then that plus measure is arrival at the first hospital or referring hospital to PCI within 120 minutes. And then we have kind of a different situation this year because it's sort of a transition year. We have 4 measures that are in an optional measure group. This is the first time that we've done this. But we have 4 measures listed here, and you need to meet 2 of them. So compliance on these 6 measures needs to be at 75% or greater. Compliance on the optional group measures, you need to meet 2 out of the 4, and then they're also 75% except for arrival to 12-lead ECG within 10 minutes needs to be at 85%. So that's the only one that's different. But you need to meet at least 2 of these. We won't ask you like which 2 you want to choose. We'll just run your, we'll analyze all of these measures for you, and it'll work to your advantage. We'll pick the 2 that you're in compliance with. If you're only in compliance with 2 of them. And then just note that 2 of these are going to go away in terms of recognition for data next year, smoking cessation counseling and aspirin on arrival, and we'll talk about why that is. So right now, when you go in to run your reports and you want to look at your optional measures, this is just a snapshot of where you're going to find those. They're in 2 different places. Next year, everything will be grouped together again, but this year, 2 of those are in the achievement measure grouping, and 2 of them are in the reporting measure grouping. So this is what aspirin on arrival has looked like for over the last 8 years. So everybody's hitting it. And so, that's why this one isn't going to be a focus anymore. This one is going to be going away, or not going away, but it's going to be moved to what we call a reporting measure. So we want you to report it. We do look at it. It will be pulled into your reporting measure group, but it's not one that's going to be analyzed for recognition. And the same goes for smoking cessation. So that one, everyone's hitting it. Everyone has a system in place to do smoking cessation counseling for those patients that have a history of smoking. And so that one as well is just going to be moved out of the recognition measures, or achievement measures, we call them. So a couple things that we want you to be aware of, and that is your arrival to 12-lead ECG within 10 minutes. That one is, the one that we want it at 85%. Right now, that one's a little bit low, and it is going to be moved to an achievement measure for data next year. So you just know that you need to kind of get ready for that. For those of you that have been in this for a while, you probably remember when CMS required this. This was a publicly reported measure. Everyone was doing pretty well on it. It was a focus, the 12-lead ECG within 10 minutes. But since heart attack is no longer part of, the CMS measure group, this one, we're kind of taking our eye off of this one, and we want the focus to be back on this one again. So identifying that early within 10 minutes of arrival. And then cardiac rehab as well. This is one that will be moving from, the optional group to a required achievement measure starting with next year's data. So cardiac rehab referral and door to 12-lead ECG are going to be part of analysis for recognition. And then starting next year, with next year's data as well, we're going to have the high-intensity statin that's going to become one that we're going to make a requirement for recognition. So there's two medications, Lipitor or Crestor. If Lipitor is ordered at 40 or 80, or Crestor is ordered at 20 or 40 milligrams, that patient qualifies for needing the high-intensity statin measure. And you don't have to mark high-intensity statin on the data collection form. If you put one of these medications and one of these dosages in there, it will automatically move that into the high-intensity statin category for you. So something that we know in the science is really strong around the high-intensity statins. It was included in the 2015 lipid performance focused update, and so just know too that this one is going to become more of a focus, and it will become an achievement measure in 2021. And then we've had arrival at first facility, so that first hospital or referring hospital to PCI within 120 minutes. It's been a plus measure for us since the beginning, but we're actually going to move that into the achievement measure group. So starting with next year's data, it's going to become a required measure, but we are going to lower the compliance level to 50%. Right now, as you can see, people are sitting around 70% or so, and we have an advisory group or an advisory work group. It's a group of physicians from across the country who, gather on a regular basis and help us make these decisions. And that group feels that this is an area we really strongly need to focus on in the next couple of years, that we need to move the needle on this. And that's the system measure of, when that patient starts out at a referring hospital, the timer starts and stops at PCI at the second facility. So it requires a lot of coordination of care. We want that to happen within 120 minutes. And something that, this is just a visual of what's happening there. So this year it's a plus measure. We want it 75% or greater, and then with next year's data, it will become a required measure of 50%. So I put these in parentheses. I think we can get a little confused when we talk about 2020 recognition or 2021 recognition. That's why the data is in parentheses there, just to clarify that it's a plus measure with this year's data, and then it'll be required with the 2020 data. So something that we are going to make a new plus measure with next year's data, and this is, I think, going to be really challenging, but it's something that it's going to be a stretch goal for everyone, and that is to include the patients that started with EMS before they got to the first hospital. So I don't know if you can see my cursor, but we've got ambulance, first hospital, ambulance transfer to the second hospital, and to the cath lab and PCI, all within 120 minutes. So that's a new stretch goal. If they started with EMS, before they got to the outlying facility, that time is going to be counted in as well, and that becomes our new stretch goal or our new plus measure. And so we're dropping out the composite score. That we used to use the composite score and factor that in with the achievement measures, but because this is a transition year, we're just temporarily suspending the composite score, and that has traditionally been needed to be over 85%. That will come back again with next patient discharges next year, but suspended for this year. And then don't know if we have any referring hospitals on the line. Christian, I don't know if you can tell from the attendee list, or you guys can come off mute if there's anybody that's representing a referring hospital.
Hey, Lonnie. No, I can't tell. Some of the names aren't showing up, but if you'll just type in that chat box, if you're a referral center, or if you want to come off mute and I can unmute you. Or I can go ahead and unmute everyone, but it will automatically unmute your line and you would have to mute yourself again. So however you want to do. If you want to send me a chat that you're from a referral center, or ask to be unmuted and I can unmute you.
We'll give everybody just a minute to do that. I don't want to go over all of these if we don't have anyone on the line from a referring hospital. Okay. Do you see anybody? Does anybody text anything in?
No.
Okay.
No comments
right.
or requests to come off mute.
Okay. So I'm going to skip over those. Because it'll take us about 10 minutes to go over those, but they're included in the slide set and they'll go out to everyone. Let's just quickly go over STEMI measures. So there's 5 STEMI measures: cardiac rehab referral, ACE and ARB, dual antiplatelet therapy, which everybody seems to struggle with a little bit. We want that at 65%. Adherence, and the LV systolic function is evaluated in smoking cessation counseling. And something that we've done to help out with the cardiac rehab referral, because it's not appropriate for all patients, sometimes there's really, valid reasons why a patient is not going to be able to go to cardiac rehab. So we did modify this measure to include, like medical reason option, patient-oriented reason options, and health system reason options for not making that referral. And then just know that next year, arrival to 12-lead ECG within 10 minutes and high-intensity statin therapy at discharge are going to be become measures. And then beyond, in 2021, we're adding early cardiac troponin within 6 hours. So these are things, just kind of a heads up for those of you on the line. Like, these are things you're going to want to start working on if you're not already. Also, risk stratification of STEMI ACS patients with a risk score, and then early invasive strategy within 24 hours for those high-risk STEMI ACS patients. So right now, just reporting measures only, but what we have found historically is once something becomes a reporting measure, there's a high likelihood that it will become an achievement measure at some point. Just a note about feedback reports. People who are using these are loving them. When you go into the operational report section of the registry, if you have your patient information in there, you can pull back a feedback report on that patient and it will auto-populate all of your time. So you do not have to manually enter all of those times. It will be calculated for you. This is such a time saver. I wish that I would have had this option when I was manually doing feedback reports to EMS and referring hospitals. It is in Word. And so you can, if you want to pop in your 12-lead ECG or your film, that's really easy. Your pre and post cath films, it's really easy to do that. Or if you want to just add a few comments about, the case, you can just type those in there and send it off. So if you haven't checked out that feature, check it out. Especially for those of you that are entering the data more concurrent with patient arrival, and you're following that patient through their care and entering information right in to the registry as you go. We are getting more and more mobile device friendly. You can use it right now with a pad, like an iPad or tablet. It works really, really nice, and I've even pulled it up on my phone. So we're making it so that you can, if you want that option to be able to enter information right into the registry as you go, you're able to do that. So something that's brand new for us is we're starting a voluntary public reporting program. And this is for any of our hospitals that are in any of our Get With the Guidelines programs. You can opt in or opt out. It's completely voluntary. You could opt in for coronary artery disease and opt out for stroke, for example, or vice versa. It's completely up to the facility, but it's something that we're doing so that, number one, we can help the customers to be aware of the hospitals in their area that are participating, and what their data looks like. It's also the type of thing that factors in with national hospital rankings. So, for example, U.S. News and World Report. And then, some health plans give credit to hospitals that are doing the voluntary public reporting. And then it meets some of the hospital accreditation requirements like primary stroke center. So we're really excited about it. You can opt out anytime. If you decide to opt in, you can opt back out. You just send a note to our contracts team. The email is here. The data is updated annually. The website will go live next month in October. Their emails went out to the person that's listed on the contract for your facility. So if that's not you, you might want to talk to the person whose name would have been on the contract, see if they received the email to opt in or opt out. And if you haven't seen that and you want to opt in, please notify us, get in touch with your local director. If you don't know who that is, please, get in touch with us and we can help you understand if anybody's responded from your facility, and, you can let us know where you want that information to go. But the person on the contract would have received a link to opt in or out. It's all done electronically. We're starting with 2018 data. So when we go live next month, we're starting, what will be on there are numerators and denominators of each of the achievement measures, and then the percent achievement level. There needs to be at least 30 records entered annually, or an attestation of 100% submission with a minimum of 6 patients per measure. And then if the criteria is not met, the volume criteria, then it's just volume too low to report will be displayed on the website for that measure. And, the public will be able to go on, search by zip code. It'll look something like this. It's just a mock-up, but they'll go in, put in the zip code or city, state, select a radius so that they can find hospitals near them and see how the hospital is performing. So for many of you, this is going to be a really nice way for you to show off your performance and for the public to be able to see that you're doing well. The public reporting measures for STEMI are listed here. Again, this is 2018 data, so numerators, denominators, and percent achievement for each of these measures will be on the website if you opt in for your facility. And then STEMI, these are the measures, so it's the 5 that we just talked about that will be part of the public reporting measure set. And then, once we've run the data in the spring, we'll take a new snapshot, and that will be what will be loaded on the website. This is just the survey that went out, the opt-in, opt-out survey that went to, whomever. It would be the person that's on the contract with the module. So for the CAD module, whoever signed the contract. And then just a quick note, a reminder about deadlines. So for those of you that are doing direct data entry, or option 1 or option 2 facilities, you have more flexibility in terms of deadlines. Like I said, you're going to have all the way until February 28th of next year. to be able to edit any of your 2019 data. But these deadlines that you see in front of you are more for people who are option 3 hospitals. If we have any of those on the line, that's when that picture is taken for the Mission Lifeline report. The Mission Lifeline report for option 3s is a static snapshot in time. So these are the deadlines that that we use, and we take that snapshot like the next day or a couple days after the data deadline. And for people that are option 1 and option 2 facilities, like you can run your Mission Lifeline regional and hospital reports. They're more real time. Our reports are designed to be like you put the patient in, and then the information shows up in the report. So you're not waiting for information. Like if you put a patient in yesterday and you have a meeting today, you run your report and that patient's going to be in there for you. This is just a reminder that the boot camp series that we did in the spring is available. All of these topics are available on demand. You do receive free continuing education hours for viewing them. You can go in and find them at this website. It's heart.org/SWA quality, and sign up for them there and listen to them. And this says Thursdays at noon, but they've all taken place, and now they're just available to watch and listen to on demand. And then we have this new partnership with the Joint Commission. We're offering advanced cardiac certifications for hospitals, and we're doing hands-on workshops. We're doing 3 more this year. We're doing one in Denver next week. We're doing one in Houston end of October, and then in Austin December 5th. So if this is something that you're interested in attending on behalf of your hospital, please let us know. We'll send you the information so that you can get registered for any of those. And we just cover, the standards and the measure sets for those programs. And Get with the Guidelines Coronary Artery Disease is it's the required data source for these new advanced cardiac certifications. So I'm going to stop there and just see if there are any questions and check the chat box. And
Hi,
if
Lonnie.
you're able,
I don't see any questions yet.
Okay.
But if you want to type the question in the chat box or come off mute, just let me know in the chat box. You should be able to see the chat box on the right hand of your screen.
And then, Kristen, do they hit *6 to unmute their line, or?
No, that's not going to work.
Okay, that's okay.
I mean, I can unmute everyone, but it's going to automatically unmute them even if they're wanting to be muted.
Yeah.
So,
so we'll just use the chat box.
Okay. And one other thing I wanted to mention, in addition to that EMS feedback form, there's also a section to do a spreadsheet, a time tracker spreadsheet that has this information in a spreadsheet as well. So it's going to have all of your door times, EKG, PCI, all of that, and it's going to calculate the numbers in that spreadsheet as well.
Yep, thanks, Kristen. The other thing that's really great is, like if you're looking for information by physician, like you're doing report cards, you can filter, like say, for example, by your interventional cardiologist. You can run the measures per cardiologist, so it will, there's a little filter button. Just be aware that you can do that too, because I know that's something that I used to also create by hand, and you don't need to do that. And when you print your reports, you can print them in any format that works for you, for your meetings. So you can pop them into PowerPoint, you can PDF the reports, you can pull it out in Excel so that you can filter and sort that way. So just know that it's set up so that you have a lot of different options for getting your information out, as well as just a raw data download. You can get it anytime. And that's all found in operational report section.
And I just wanted to note that the print button has moved from the right side to the left, and there's an easy print button now, and it will print it in PDF, but there's a drop-down menu if you want to select PowerPoint or Excel. It's still there, but there's an easy print button as well.
Any questions, Kristen?
I do not have any questions in the chat box.
Okay. Well, feel free to email us if you think of anything after. And like I said, we will get the slide set out to you. We also have the information about, the 2020 recognition program, this year's data, and then out to 2021 recognition. That is all set, which I love, so you can start to look ahead. But we have those all on like one-pagers that are really nice as well. So we'll send those out when we send out the slide set. But thank you so much, everyone, for all of your work. And let us know if you need anything. We'll just close out. Hope you all have a good day. Thank you.